So, if you, no, what did I say? Oh, this video is for information purposes only. If you do have some real pain or problems, go see someone about it. Don't sue me if you fuck up. So, I put the question box up on my Instagram and asking what people want to see or learn more about, and the vast majority said the hip. Now, the problem is, the hip is kind of used very loosely with people. So when you ask them where the pain is and they say the hip, that can mean either kind of the groin area, that can mean the outside of your glute, or they can even mean the low back. So it's kind of hard to know what people want to know more about. But today we're going to focus on the actual hip. The hip is a ball and socket joint, meaning that it needs a lot of movement, and there's a lot of small muscles and big muscles surrounding it. So the hip joint is a very mobile joint, and it performs the following movements: flexion, extension, internal rotation, external rotation, abduction, and adduction. There's a few key muscles with the hip joint. There's a lot of muscle groups, but the key ones is the iliopsoas, that performs the flexion and internal rotation. You have the glutes, which is consisting of 3 muscles. It performs external rotation and extension of the hip. It's very active when you walk and when you go from sit to stand. Adductors, which is also a group of muscles. The interesting thing about the adductors is that they adduct your leg. They can do internal rotation, but they can also do knee flexion and act with the hamstrings. So it's quite complex to get your head around everything about the hip, but we're going to try and make it as simple as possible. The hip joint can be dysfunctional and you can have pain from it, or it can be dysfunctional and you wouldn't know about it. So if you do have an issue, it's very important that you go and see someone so you can establish what's causing the pain, because it can be a mixture of all of them together, or it can just be one thing. When we talk about hip pain, so I'm going to talk about the hip pain as in the front of your leg rather than on the side. More often than not, when you have pain, you will have some stiffness as well. Most oftenly, you lose the flexion, internal rotation, and abduction first. So that's kind of what we always see people struggle with. So I work with a lot of athletes, and they most often complain about pain when they squat, bench, deadlift, do lunges, for example. The problem is that the hip needs, like we said before, a lot of mobility. If that gets a little bit restricted, your body's going to compensate because the movement needs to come from somewhere. What happens is that you overload either your knee or you overload your spine, which causes pain, even more pain. So I always try and look at the whole picture, look at the painful movement to try and establish exactly what is going on with that particular athlete. So for example, for squats, usually the patient feel pain at the bottom of the squat, and that's kind of where your external rotation and everything is kind of pushed to its limit. If that's restricted, then you will feel pain. And sometimes it can even be difficult to hit depth, and that can be a lot of different causes, and one of the most common one is tight hip flexors, for example. A patient complains about pain when they bench. That's also a thing where hip flexor can be tight, and when you try and arch, you stretch your hip flexors and it creates pain. And usually, more often than not, the patient complains about low back pain as well, because when your hip doesn't extend the way it should, your low back will take over the movement, and hyperextending the low back when it's not supposed to do that in an arch, in a bench press, that will cause pain. So it is really hard to grasp kind of every single cause of every single pain that you may have, but I just want to get across that if you do have pain, you need to see someone to just have a look at how you move. So a lot of people have low back pain and knee pain, and a lot of that can actually relate to your hip. As a rule of thumb, if a patient comes in and complains about a pain somewhere, I always look at the joint above and below, just to make sure that everything's moving the way it should. So again, just because you have pain in one place doesn't mean that that's necessarily where the pain comes from. I'm going to show you a few ways of checking your range of motion of your hips. If you go to a physician who can check it for you, that's the most optimal thing. It's hard to assess it yourself, and knowing the exact degrees and how it moves and everything. There's this thing where if it's a bit restricted, you kind of need to know why it's restricted. So it's a little bit complex, but we're just going to go through some of the main movements and what's normal. The easiest way to check flexion is just to do this. So you should be able to get 110 to 120 degrees. So that's obviously 90 degrees, and you should be coming up a little bit more up like that. For hip abduction, that's 30 to 50 degrees, so it's important to stay straight. So you want to go to about there, and you need to make sure that you don't do that. So you pull over. So you can always cheat. So this is the thing where if you have someone looking at you, it's so much easier because they will know if you're overcompensating or using something else that you shouldn't be using. So you want to do this, 30 to 50 degrees. So that's obviously about 50 degrees. So don't do that, don't try, come closer. Then we have adduction, which is 20 to 30 degrees. So obviously you want to, and again, you don't want to do kind of that thing where you actually create the movement from the spine. So for the internal external rotation, it's easiest to lie on your back. So you lie on your back, you put your hip and knee in 90 degrees. So this is internal rotation, that should be 30 to 40 degrees, and that's external rotation, and that should be 40 to 60 degrees. And then the last movement is hip extension, and again it's very important that you don't use the wrong joint to create the movement. So hip extension is that bit, so you can do this if you want to, but obviously that's just leaning forwards. So you need to make sure your pelvis is stable and like that, and that should be 15 degrees. When you do this, if you feel restricted or pain, that's a sign of a dysfunction. And it's going to be difficult for you to identify what's causing the pain and why. But we'll give you a few tools on how to fix it. So like I was saying earlier, the hip is surrounded by a lot of muscles, and there's a concept called referral patterns, which means that the muscle knots or the trigger points can give you pain in a different place. So if you have a trigger point in your glutes, for example, it can give you pain all the way down to the front of your hip. Or if you have a trigger point in your psoas in here, it can give you pain down to the hip. So just because you have pain in one place doesn't mean that that's where the pain is coming from. And again, it's up to the physician you see to identify what's actually causing your pain and where it's coming from. So there's a few key muscles that I was talking about earlier. You have the psoas muscle, which attaches from here on your back, goes to the front, and then inserts into the inside of your hip. So if it gets trigger points up here, it can give you pain down to here. You have your glutes muscles. It's basically three muscles, gluteus maximus, medius and minimus. They all perform similar movements. The medius and minimus are more involved in stabilizing your pelvis or being active when you walk, whereas the gluteus maximus is more of a strong hip extensor. So when you push off when you walk, for example, that's when you use it. So on the outside, it can give you pain on the inside or down your leg. So again, if the pain is somewhere in one place, doesn't mean that that's where the pain is coming from. You have your adductors, which is on the inside of your thigh. They are quite interesting in the way that they perform a lot of different movements, and depending on what adductor you're talking about, it has different movements. So the adductors here, on this kind of more towards the quad side, they perform adduction and hip flexion, whereas the ones that kind of run here, they can do adduction again, but they do knee flexion. So the hip is complex, and a lot of muscles, different movements. Just because you have pain in one place doesn't mean that that's where it's coming from. A lot of people feel stiff before they're going to train, and they want mobility exercises to improve the range of motion of the hips and feel a bit looser and warmer. So we're going to go through a few things. The first thing is the couch stretch. It stretches your hip flexors. So you lunge down in a position and you hold a stretch for 30 seconds. The second is a 90-90 stretch, so it improves your internal and external rotation of your hip. And then we have lateral lunges, so it's like a lunge, but it stretches the adductors. Then we have hip airplanes, and it improves your external rotation. And then we have a squat internal external rotation with a hip band to again improve your hip internal external rotation. And then we have a glute stretch, which stretches the glutes. Knee on the floor, and then the goal is for your heel to touch your bum. If you can't do it in the first time, that's absolutely fine. You just want to work up towards it. You need to hold the stretch for 30 seconds to give it enough time to lengthen. And you do the same thing on both sides. So the hip 90-90 is this leg 90 degrees, that leg 90 degrees, and you hold it, and then you swap around 90-90. And I can feel this side is a lot stiffer, so I do struggle to get into the position, whereas this is a lot easier. Lateral lunges, it will depend on how mobile you are when you do this. You kind of want to improve the range of motion for each rep. If you can't do much in the beginning, that's absolutely fine, as long as you push it a little bit further for each rep. So lateral lunges, just like that. You kind of just the hip external rotation in a squatting position, you need a hip band, and that just helps improve the range of motion a bit more. So you put a hip band on around just above your knees, you squat down, make sure you push your knees out, and then you just push your knees out, in and out. So when you do this glute stretch, there's a lot of different glute stretches. This is the one I prefer to do. What's important is that you need to keep your back straight so you don't overload your spine. And I hold my knee and I kind of push it towards me to get a better stretch. And again, when you do stretch, hold it for 30 seconds just to give it enough time to lengthen. So now we're going to go through a few exercises to strengthen your hips or to have more functional hips. There's just a couple of key exercises that I prefer to people to do, just because they work. The first one is split squats. So it's basically like a couch stretch, but like a movement. You can add weights if you want to. It's not necessary, especially in the beginning. So the key thing is and again, don't overextend like that. Keep your upper back or your back straight. Common exercise you see a lot of people do is hip thrust. You can add a barbell if you want to, or you can just do it with a hip band or even a dumbbell. It's completely up to you what equipment you have and what you prefer. So I prefer to use a hip band. I use hip bands on most exercises just because it just engages my glutes a lot better, and it just makes me activate the muscles that I want to actually activate. So you put it around your knees. You need to have a bench. So you put your shoulder blades on the bench. You put your knees in a comfortable position. It can be either shoulder width apart or wider. It's completely up to you. So the important thing is to push your knees out at all times. So you go down, and the movement needs to come from the glutes and not your lower back. So you want to drive up and squeeze your glutes and down. And the important thing is not to overextend your back, so you just want to squeeze your glutes, and that's the only thing. The last exercise is kettlebell swings. I prefer to have an adjustable kettlebell swing because you can just add weights and you don't need to have 15 different ones to get the weight you want. So this is really good to open up your hips and strengthen your hips. I prefer to do it as an assistant exercise to my deadlifts. So what you do is choose a stance that you feel comfortable with, hold the kettlebell, and then you kind of do a bit of a squat, good morning kind of hip hinge, and then you drive through with the glutes and let the glutes create the movement. The important thing is to push your knees out.
Okay.
So that was a few examples of stretches and strengthening exercises to increase the mobility of your hips if you have mobility issues, or strengthen your hips if you feel a bit weak or if you have some weaknesses.